This meeting is being recorded.
Hi, this is our adult fact sheet on Myasthenia gravis. My name is Shauna Dowling.
My name is Sarah Houchin.
My name is Lauren Lever.
I'm Julia Seymour.
My name is Akita Green.
And so we're just going to take you through our presentation on Myasthenia gravis. And our client introduction is, so his name is Deshaun. He's a 64-year-old male. He lives with his husband in Philadelphia, Pennsylvania. He's a school principal. He has a dog that he enjoys going on walks with, and he enjoys working out. And he suffers from diplopia, has an unsteady gait when ambulating, and he has comorbidities, which include rheumatoid arthritis and hyperthyroidism.
So before we get specifically into our client, we're just going to talk a little bit about MG. So to start, we're going to talk about the diagnostic criteria. For MG, there are several tests that are needed to fully diagnose someone. It's not a one tell all. It has an abundance of signs and symptoms, so it makes it very difficult to diagnose. MG is often missed or delayed with diagnosis, or misdiagnosed as a different disorder. Some tests that are needed to diagnose would be physical and neurological examinations, blood tests, diagnostic imaging, and pulmonary function tests. So as you can see, that's a list of 7 tests. You need multiple tests to be able to identify MG, just because it has so many different signs and it presents in so many different ways for so many different people.
So just like Sarah had just said, there's a bunch of different diagnostics needed for myasthenia gravis and a bunch of different signs and symptoms. And to give some etiology and statistics about it, it is a neuromuscular disease that causes weakness or fatigue in the skeletal muscles. It is a very progressive disease, and it does affect both males and females. It is prevalent in the United States of about 14 in 100,000 people. So what happens is the immune system fails to recognize itself. And it also affects the thymus gland, and in about 75% of people with myasthenia gravis, the thymus gland is abnormal, and it causes hyperplasia, which is enlargement of an organ or tissue, thymoma, which is disease of cancer cells that form in the thymus, and it also affects the eye muscle specifically. So to see some signs and symptoms in a person with myasthenia gravis, it's very obvious and visible. So they have visual disorders, drooping of the eyelids, double vision. They have problems chewing and swallowing, slurred speech, breathing problems, weakness of muscles that they are repeatedly using, weakness in their limbs, and most of the time, as previously said, having an abnormal thymus gland.
So as far as disease and medication management, there are several treatments. For medications, a lot of times these medications are just used to alleviate symptoms. They're not a solution to the disorder, or they're not going to reverse the acts that it has, but it's just to alleviate a lot of the symptoms that people will suffer from. These medications include muscle strengtheners, steroids, and immunosuppressive drugs. A lot of people often go through surgery to remove the thymus. As Julia said, they typically have an abnormal thymus that is causing dysregulation. So removing the thymus will remove a lot of the symptoms that they are feeling. And then there's also plasma exchange, which is just to remove the abnormal antibodies from the blood, because the body is, in a sense, kind of attacking itself. And then obviously with medications, there are complications that can occur. There's something such as myasthenic crisis, which is total weakness of the breathing muscles. This obviously can result in hospitalization, and a lot of people end up on a ventilator because their breathing muscles can no longer function. People with MG are also at a higher risk for other autoimmune disorders, such as thyrotoxicosis, rheumatoid arthritis, and lupus, I believe, as we stated before.
So there are many implications for occupational performance when it comes to a patient or a person suffering from myasthenia gravis. So in specific, I have included the performance skills that are affected are Deshaun's ability to walk long distances. He is a principal and he lives within walking distance from his school, but he's incapable of walking to his school, even though he is fit and likes to work out because of how much pain it causes him and how his gait is very unsteady. So it's become unsafe for him to walk to school. So as it says there, as though he is active and he can perform seated exercises, it's very difficult for him in the gym to run or walk on the treadmill or do anything that includes excessive or walking endurance for a long period of time. Another implication for occupational performance would be the impact that MG has on client factors. So one of the client factors that is affected in Deshaun's case is his ability to see. As stated before, he has diplopia, which is another way of saying double vision. So his visual functions are altered. Therefore, things like his visual acuity, his field of vision, and his visual awareness are altered, which includes him being unable to drive himself to work sometimes. So what that means is that if he has a part in his life where he has diplopia, or a time in his life where he's suffering from diplopia, his husband has to drive him to work, which then again affects how he feels about himself, because now he's incapable of doing things like driving himself or walking his dog, and those are occupations that he enjoys. The last implication for occupational performance that is affected is his roles and routines. He's unable to fulfill his role as a pet owner because he's not able to walk his dog due to his unsteady gait, due to his when he suffers from diplopia. Same as things like making himself breakfast or going grocery shopping. These are all occupations that are his routines and roles. He used to do them on his own. He used to do them, drive himself to the grocery store. Those are things that he's no longer able to complete with ease due to the fact that he suffers from having double vision, which makes it difficult for him to walk around the grocery store and see things around him. And then his unsteady gait makes it hard for him to walk around. So one thing that he will do is use the cart that you can go through the grocery store seated, but still it gives him discomfort knowing that he's not able to do what he used to be able to do before the diagnosis of myasthenia gravis.
So now we're going to talk about some of the occupations that can be affected with myasthenia gravis. So one of the things is physical activity. So as we mentioned earlier, myasthenia gravis is a neuromuscular disease, which can cause significant weakness in the arms and the legs, as well as the muscles required for breathing. So the patient may have difficulty with physical activity. So how can we as occupational therapists work with our patients on this? We can help them with muscle strengthening. We can also help them with education on pacing themselves throughout their activities in their daily life. And we can also work on energy conservation techniques, such as like breathing techniques and things of that nature. The next occupation that we're going to be talking about is functional mobility. So as we also mentioned earlier, myasthenia gravis patients can also deal with some visual deficits such as ptosis, which is drooping of the eyelids, and diplopia, which is double vision. So this, coupled with musculoskeletal weakness, can cause some significant issues with balance. So what can we as OTs do? As OTs, we can work on some balance strategy training. In a study done by Wong et al., they did 16 training sessions, and that showed significant improvement with balance among myasthenia gravis patients. So also what we can do is we can fit the client for an appropriate assistive device and educate them on the proper way to use those devices. And we can also educate their family on how to help them with their functional mobility. So the next occupations we're going to be talking about are showering, bathing, and dressing. So again, with the difficulty with balance, we could also see the patient struggling with their showering and their bathing, as well as their dressing. So what we could do with this is we could recommend some adaptive equipment in their bathroom, such as safety rails and also a shower chair or a shower bench. And we could also help them with dressing by maybe have them in a seating position, complete their dressing activity. We could also help them with some adaptive equipment, such as a reacher.
In terms of interprofessional care, there are many professionals that work alongside patients with myasthenia gravis. That includes a neurologist, a thoracic surgeon, as well as a speech pathologist. So neurologists do perform the exams leading up to the diagnosis of myasthenia gravis, and that includes conduction studies, repetitive nerve simulations, a single fiber electromyography, and a CT and MRI scans to assist them with diagnosing the individual. The thoracic surgeons are responsible for removing the thalamus gland and help reduce hyperplasia, thymoma, and issues with the eye muscles. Speech pathologists do assist the patients with their speech and as well as their voice muscles and eating and swallowing various foods. And that concludes our fact sheet, and these are our references. Thank you so much.